severe acute respiratory distress syndrome. Definition. Acute respiratory distress syndrome is a life-threatening lung condition that prevents enough oxygen from getting to the lungs and in the blood. Condition characterized by widespread inflammation in the lungs.
Is acute respiratory distress syndrome. Acute respiratory distress syndrome is a life-threatening lung condition that prevents enough oxygen from getting to the lungs and into the bloodstream. What are all the causes that can lead to acute respiratory distress syndrome? Acute respiratory distress syndrome can be caused by trauma, sepsis, shock, gastric aspiration, uremia, acute pancreatitis, or amniotic fluid embolism. Describe the pathogenesis of acute respiratory.
An application in medicine, down in all chemicals affecting our lungs. Go periodically to consult with your attending doctor. Prevent drug abuse or drug overdose. Avoid multiple blood transfusion.
This is Andrew Wolf, and I am going to make a short video about acute respiratory distress syndrome, otherwise known as ARDS. Now, acute respiratory distress syndrome is a disease of lung inflammation, and the inflammation leads to a cascade of events that lead.
The advantage and disadvantage, if the disease is treated, good lifestyle will have, and lung transplantation can lead to the disease suffer.
Yes, is by looking at the PaO2 to FiO2 ratio. This ratio tells us how severe the disease is. If the ratio is between 200 and 300, we have mild ARDS. Between 100 and 200 is moderate ARDS, and anything less than 100 is defined as severe ARDS. The third criteria.
This is pulmonary fibrosis, ventilator-associated pneumonia, acute renal failure, electrolytic deficiency, and barotrauma.
Pulmonary fibrosis is a set of diseases that cause progressive scarring inside the lungs. Over time, healthy tissue is slowly replaced with scar tissue, which causes airways to be blocked, restricting airflow. This makes breathing difficult and chokes off the amount of oxygen needed.
Thank you.